NBC viewers have been sending in tons of great questions about the coronavirus. We're going to try to answer as many of them for you as we possibly can. Here to help me do that, Dr. Leana Wen. She's the former health commissioner for Baltimore. Dr. Wen, thank you for being with us. Before we get to those viewer questions, I want to ask you about a piece that you wrote for Rolling Stone this week about the lack of coronavirus testing. When and how should someone get tested?
Well, this is extremely challenging right now, and I'm glad you're asking this question, because ideally, anyone who needs a test or wants a test should be able to get one.
Yeah.
And not only that, we should also be doing surveillance to find out exactly what is the incidence of coronavirus in our communities, because very likely the numbers that we're seeing are just totally inaccurate.
Right.
That the actual numbers in our communities should be tens of thousands higher than what's being reported now, only because of lack of testing. Importantly, though, as of right now, we just don't have enough tests. I mean, we can talk about the reasons as to why, but that's the situation that we're in.
Yeah.
And so if you have symptoms of coronavirus or symptoms of the flu, a cold, you're not sure what it is, the important thing is do not go to the ER. Do not go to the hospital, because you could expose yourself to pathogens. You might be exposing other people. And in addition, you're taking up capacity in a system that's already overburdened. So if you're concerned, call your doctor. Do not go to the ER unless you would have gone otherwise. For example, if you have severe chest pain or cannot breathe, that's when you go to the ER or seek acute care. But otherwise, do not go to the ER to seek care right now.
Another thing you wrote in that article, right up there in the title, you said, we're not powerless against this virus, but that our window is closing. What do you mean by that?
Well, I want to give the proper credit to the author of the article. I was interviewed for it by Alex Morris, who did a great job of writing it. But yes, I did say that we are not powerless against the virus. This is a scary time. And quite extraordinary measures are being taken to protect the health and well-being of the American people. And we're asked to do all kinds of really unusual things, like not go to school, not go to work, not see our friends and our distant family. I mean, it is quite extraordinary. But these are measures that are being taken that we can take into our own hands in order to reduce the spread of this disease. Social distancing, keeping a physical distance away from people, not being in large gatherings. That's what we can do. That's what each of us can contribute to reduce the burdening hospitals, to also to reduce the spread of the disease so that we can potentially save lives. Now, I know it's still a very frightening time, but we are at war against this virus. And it's only joining together, cooperating, collaborating, that we can get through this together.
Let me ask you this, and I think a lot of people are wondering what this could mean, and I don't know if it does mean anything for the United States, but yesterday, China reported no new cases for the first time. Today, Italy's death toll surpassed China. Does that signal anything, or is there anything we should interpret from that here in the United States?
It gives us an important benchmark, because it tells us that containment can work. China did some quite draconian measures and imposed some restrictions that might be difficult for other countries to do, but they were able to contain the disease. They were able to get the disease to a point that they bought the rest of the world time. Now, we don't know what happens when people start going back to work and start going back to school, but it shows that containment of this disease is possible. Now there's a new epicenter in Italy, in Europe, and it remains to be seen how they will cope there. And I'm afraid to say that we are going to be next, that the number of cases in the U.S. will be escalating in days to come. But how much they escalate depends on the actions that we all take today.
All right, if you don't mind, I'd love to get to some of the viewer questions because we have a lot of them and they are really excellent. Someone asked, and you alluded to this before, but someone asked, if there is a lack of testing, how will we ever know the real number of coronavirus infections?
That's exactly right. The viewer is exactly right. We just simply don't know. And it's very difficult. First, it's very difficult to be a patient who just wants to know if they have coronavirus because they want to know what's going on and will they spread it to family members. It's very frustrating to be the physician, the nurse, the clinician being asked about this when we know that our patients need this test. And it's very difficult to be a public health official, to be planning strategies when we don't know what the baseline is. And how can we even measure if our strategies are effective if we don't have the testing and the data to get us there?
This next question is a great one because this has been going around quite a bit this week about ibuprofen. Someone said, if you have coronavirus, should you skip taking ibuprofen?
There are very limited anecdotal reports coming out of Europe about ibuprofen as an anti-inflammatory and how it should be avoided for coronavirus. But there has not been a study that validates this.
Okay.
So I would say at the moment, listen to the recommendations of your doctor. And I would not start changing up your medications without speaking with your doctor first.
Someone was wondering, can you get the coronavirus and have the flu both at the same time?
In theory, yes. I think, though, that they're probably alluding to the fact that the symptoms of coronavirus could be similar to the flu. And patients with coronavirus tend to have high fever, cough, difficulty breathing, which are things that you might see for the flu also. Different than a cold, coronavirus patients tend to not be sneezing, drippy nose, and having all these cold-like symptoms. And patients with coronavirus could have body aches and atypical symptoms like abdominal pain, nausea, vomiting, diarrhea. But these are all non-specific, and there are many things that could cause these symptoms. And again, that underscores why testing is so important.
A viewer asks, why is coronavirus so much more contagious than the flu?
A couple of reasons. One is that it is a new disease, which means that none of us have been exposed to it before.
Okay.
And so none of us have immunity to it. We also do not have a vaccine in the way that we do for the flu. And that, again, is why the methods that we have now in terms of prevention and washing our hands, staying away from people, that's really the best method that we have to prevent from transmitting the illness.
What about patients who have other conditions? Someone asks, chemo, dialysis. You have to leave the house to get a lot of these treatments. How do we navigate that?
It is challenging because there are patients, there are people who have to leave their house and get medical care for a variety of reasons. I would say look at the conditions that you have and the trips that you have to take or don't have to take. Patients who need chemotherapy or dialysis clearly need to go to a whatever center they go to, whether it's a hospital or an outpatient center, to get that care. But patients who have regular appointments scheduled for a well person checkup, or to get their diabetes medications refilled, or their asthma inhalers refilled, perhaps that could be delayed, or many doctors have switched to telemedicine, and perhaps they can get those same medications refilled or their health checked up in another way. If you do have to go and go to your appointment, stay at least 6 feet away from others. Wash your hands very well. And again, try to limit your exposure to other people as much as possible.
Another reason, of course, you would be visiting a doctor, pregnancy. What advice can you share for expectant parents during this outbreak? I know I have a lot of friends who are expecting right now, and I think they're all a little bit nervous at this time.
I can definitely relate, and you can't see with the camera as it is now, but I'm actually 38 weeks pregnant myself.
Congratulations.
Thank you. So I understand.
So you're the perfect person to ask.
Right. So I think about this on a professional level, but also on a very deeply personal level too. So these studies about pregnant women just aren't there. There's one very limited case study of a case series of pregnant women from China. It doesn't appear that pregnant people have a higher risk of severe illness from coronavirus, but we just don't know. And pregnant women still are among those who are medically vulnerable because of changes to our immune system and our physiology. So I would urge for pregnant people to take all the precautions that we would recommend for others who are in that medically vulnerable category, and to really stay indoors, or when we're outdoors, to stay at least 6 feet away from others. I know we have a lot of medical appointments that we may need to go to, but it may be time to ask our OBs too about which appointments are absolutely necessary, which ones can be done using telemedicine, and when we go to appointments, to again be sure to stay 6 feet away from others.
Dr. Wen, thank you so much for the advice, both on a personal and a professional level. We really appreciate it, and I hope you stay healthy and well, and that you and the baby-to-be are doing just great.
Thank you.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.